Although not all of these side effects are possible, if they do, they may require medical attention. Check with your doctor right away if any of the following side effects occur: breath that smells like ammonia, worry, bleeding gums, blistering, peeling or peeling of the skin, blood in urine or stools. More popular, pain in the ankle, knee or big toe joint. Allopurinol. Note when taking medicine to treat gout, allopurinol is a drug that works to reduce uric acid levels in the blood, thereby helping to treat gout, especially chronic gout and related diseases caused by hyperuricemia. 1. What disease does allopurinol treat? Allopurinol has the main ingredient allopurinol, which works to reduce the production of uric acid, both in the blood and in the urine. It is this effect that allopurinol helps prevent or reduce the deposition of urate in the joints and in the kidneys, thereby preventing the occurrence or progression of arthritis in gout and urate nephropathy. In addition, the drug allopurinol also reduces blood uric acid levels for patients during chemotherapy to treat cancer with increased uric acid. Allopurinol can be used for a long time to maintain uric acid levels at a stable level to prevent the risk of recurrence of acute gouty arthritis as well as dangerous complications of gout affecting the kidneys. 2. When should allopurinol be taken? Allopurinol is used when uric acid levels in the body are higher than normal. In 24 hours, the uric acid level in the urine was measured at 800 mg per liter in men and 750 mg per liter in women. Blood levels in men reached 773 mg per liter and in women it was 595 mg per liter. In addition, the drug allopurinol is also used for the purpose of preventing new acute gout attacks. Specifically, for patients who have had an acute gout attack before, after about 3 months of treatment, uric acid levels are likely to increase again and this time it is necessary to use allopurinol for timely treatment. In such cases, allopurinol is often used in conjunction with colchicine or non-steroidal anti-inflammatory drugs to bring uric acid levels back to normal in the most optimal way. 3. Dosage of allopurinol. Dosage of allopurinol should be paid attention to avoid unwanted side effects. Namely, use allopurinol at a low starting dose of 100 mg per day, then gradually increase to ensure blood uric acid returns to normal. Usually up to 200 to 300 mg per day is sufficient, but in some cases it is necessary to increase to a higher dose. During treatment with allopurinol, if there is an acute gout attack, continue to maintain the current dose, in addition to using drugs to treat acute gout. 4. Side effects. Along with the necessary effects, the medicine can cause some unwanted effects. Although not all of these side effects are possible, if they do, they may require medical attention. Check with your doctor right away if any of the following side effects occur: breath that smells like ammonia, worry, bleeding gums, blistering, peeling or peeling of the skin, blood in urine or stools. More popular, pain in the ankle, knee or big toe joint, joint stiffness or swelling, rash with flat lesions or small raised lesions on the skin, rare, excitement, chest pain, which can move to the left arm, neck or shoulder. 5. Warnings and cautions when taking drugs. Immediately discontinue the drug and consult a doctor if any skin reactions such as maculopapular or pruritus, purpura or other signs of hypersensitivity worsening including exfoliative rash, Stevens-Johnson syndrome occur. And toxic epidermal necrolysis. 10. Flu-like symptoms, high fever, skin peeling, widespread erythema, appearance of bullae, purpura, mucosal necrosis, ulceration and ulceration of natural cavities. These are manifestations of the syndrome. Stevens-Johnson, SJS, and toxic epidermal necrolysis. 10. It is recorded with a lower rate of 1%, but the risk of death is up to 39% because damage can also occur simultaneously on other organs such as liver, kidney. SJS and 10 due to allopurinol syndrome. Stevens-Johnson, SJS, and 10 can occur soon after initiation of treatment, with an average time of onset of about 3 to 4 weeks and more than 90% occurring within the first 3 months. The risk factor for the onset of SJS and 10 with allopurinol use is a carrier of the HLA-B58.01 gene. Women are at greater risk than men. Several other factors increase the risk: high dose, impaired renal function, and drug interactions. Allopurinol is one of the effective drugs used in the treatment of chronic gout today. However, the use of the drug needs to be consulted and prescribed by a doctor. This not only makes the treatment effective, but also ensures the safety of the drug. Any drug, whether used to treat disease or support health, has its own principles of use. If you do not understand the basic principles when using drugs, patients may misuse them and bring harm to them. Unwanted effects. Please consult your doctor before using medicine. Please click subscribe and press the notification bell to support me. Thank you.